This is what we need. And so I changed every email to have their name on it, and I mailed it back. I heard from quite a few of them, including one who lost the election on Tuesday. I said, I'm not going to be able to be there. I'm going to be at Utah State that day. But the state PTA president is going to be there to speak. Because I went to the state PTA Special Needs Committee on Monday, and I talked about this, and I gave them the handouts. I went to another PTA meeting on Wednesday. I talked about this. So I knew today was covered. Liz spoke this morning, but two moms showed up. One has a teenage son with autism, and is Tina Purcell's son on the autism spectrum? So, but they're different, because Tina's son is very involved, is in a wheelchair, and Laura's son isn't. They were there to speak. And I also said, and I'm sure the director of special ed will be there to answer any questions you have. And he said, oh, great. So just before noon, I got the text message which said, special education budget request of $10.2 million is number 5 on the State Board of Ed budget request. So
Yay.
Sometimes you're late, but we had extra help, and it got through today. Yeah.
When you say last, you mean it didn't get turned in?
Yeah, because of the changes.
Okay.
Yeah. Lana turned it in June, and Brenda left abruptly in July, so it just, they said, what happened?
Lost in the shuffle.
Got lost. What happened? Where did it go? But fortunately, they were willing to hear it today.
Good for you.
Yay!
So, but that's the value of having the relationships.
Yeah.
Being somebody saying, oh, this is from Jan,
I know who
Ken's all
she
the
is.
meeting, I know
Yeah.
who she is, rather than somebody coming out of left field and having no idea and you're not paying any attention to what was going on.
So now it has to be heard before the Education Committee at the legislature. So it's really great that it's made the budget this far.
But we don't know what's going to happen with the governor.
Right.
Because there are now barriers, as Joyce explained, to affecting the governor's budget. But the legislative analyst, who grew up in Wellsville, understands the issue. He's, because we have relationships with him, we all do. And so he understands it, and hopefully he'll add it to the recommendations in January.
I can ask at the end, it's okay.
You guys, it's gonna.
I was just gonna ask if you guys have paid positions.
Joyce and Jan are totally volunteer. I was a volunteer for years and years, but now I'm the administrator of the Statewide Independent Living Council office. So I finally grew up and had a job when everybody else was retiring at my age.
Does it fall under education? What does it fall under? I'm curious. Yeah.
Oh, the State Office of Rehabilitation, this
Okay.
was kind of one of the strange moves a few years ago. The money comes through education. They moved it to workforce services. No, economic development is what it was called. And then, 5 years ago, it went into this massive social services committee with things that,
Well, the State Office of Rehabilitation did. And special education is still over under education.
Still under education, and you work with Glenna Gallo?
yeah, yeah. And,
As Jan said, she told you what she specializes in. I do the Office of Rehabilitation, Independent Living, so, and then Joyce and I help Joyce with Medicaid and developmental disabilities, so.
Cool.
and health. And health.
Medicaid,
What Medicaid?
And she has been attending the healthcare reform task force. I haven't done a very good job of that this year. Are you attending that?
I've attended most of them, but I missed a couple.
Yeah.
Joyce has gotten off.
We try to be informed. We hang out with other public policy advocates who work on, and they have been known to, I'm careful about who I say what to and who's around me, because it's been used against my issues in the past. So I look, okay, I can tell you something. But if you have relationships with other advocates and they overhear something, they will come to you and say, so-and-so needs to hear about this. You need to talk to somebody about this issue. So we help each other out. So in December, we're waiting for the governor's budget. And then, yes, and she says, send your legislators a holiday card that includes a picture of your family. That's particularly poignant.
But it really is a year-round activity. And if you really want to build a relationship with the legislator or anybody else in a policy position, don't wait till it's their busy time to do it. Do it during the year, work on that. You don't, and maybe don't even take any kind of issue to them, just get to know them.
Well,
And just so that they
and
know who you
particularly
are.
this year, in an election year, we have a whole cohort of new legislators who will be in the House. There are less so in the Senate. But for the most part, these newbies are going to be looking to their party's leadership for how they ought to be voting on issues. So if you have an opportunity to meet with them and discuss your issues, they'll know that there's a constituent in their area who has a particular concern. And your perspective will help color their vote.
I mean, before the election, we were really encouraging people to get out to any kind of legal candidate activity that was available. Because, and make sure that our issues are brought up in the questions. They always come in with presentations and usually take questions. Make sure that at least there's something to do with disabilities brought up in those meetings, because we really want policymakers need to know, because they make the final decisions. But they're answerable to their delegates and to their constituency. So your neighbors and friends, the people in your ward and community and what have you, they all need to understand how important these services and supports are, because they're the taxpayers who are paying for them. And we get a lot of pushback, well, why should I pay your money to help her son? Well, that's kind of what we do. But that's a lot of more, particularly more conservative legislators really look at that. And so they need to be getting information from people, not just the choir. I mean, we walk into a room, they know what we're going to say. We really don't even have to say anything, but we do. So it's really important that the community at large know how important this is. These are the new, well, they're not new, one of them is new. Mila, we don't have any phone numbers for her yet. This is the federal information from the Capitol Switchboard.
And emails are still the best way.
Oh, yeah, it's snail mail for
Remember the
Washington.
anthrax a few years ago?
You can send, if you send it to their local offices, if you send it to the Utah office,
Yes.
then they'll forward it on and it gets there faster. If you want to write something handwritten or send them that kind of information. Other than that, a fax or an email is better to go to their staffs in Washington. And look at this, government policies do affect you. Whatever kind of a policy is, and you can in fact influence and affect government policies. Because if they don't hear from you, they figure everything's fine. I had a legislator tell me one time that he didn't think that he had any people with disabilities in his district. And I said, well, man, we got it in the water where I live. And because he had never heard from anybody.
So is there a place that you can find what issues other districts are discussing so we could bring it to our district in case there is somebody like that who thinks, well, everything must be fine? Is there something online that you refer people to say, this is what we're discussing here, this might be an issue for disabilities in Logan? Does that make sense?
Not quite that refined. at this point in time, because the coalition doesn't have any staff anymore. There was
The
a
one time
time
we did.
when we had staff that we were able to have more things online. But if you'll watch, you can go online and look at, like, for disability legislation, you'll find out what's happening with that. And it'll all be categorized, and you kind of pull it up and see what kind of things are going on.
Kinda like
what
this.
kind of bills. But it'll be what bills are coming up this year.
Okay.
And on the website, there are already bill requests.
Oh, yeah.
And so you can, when you get there, look at everything, or you can do education, you can do disabilities. You need to go more than one place, because it might not be obvious. Mental health, substance abuse, but they're already there.
They're categorized by subject.
Mhm.
Yeah.
But since Jan made a plug for her special ed, I'm sure that Chris and I can give you a couple of topics as well.
Yeah, healthcare.
You've probably all been following the Medicaid expansion discussion. And the legislature will be making a decision about Medicaid expansion this year, or not making a decision. So I don't know
And
how.
just by the way, we have lost millions of dollars by not.
I was gonna say, isn't there federal money that comes, and if you don't expand, then you don't get that?
Correct.
And we haven't been getting it for 3 years.
So, it's very possible that they'll be trying to do something in the first couple of weeks of the session around Medicaid expansion, so that something can go into effect as soon as possible. So, you need to know that, have you all heard about the governor's Healthy Utah plan? Okay, so Healthy Utah is Utah's take on Medicaid expansion, and it would go up to 138% of poverty, which is the same as the income guidelines for just a straight Medicaid expansion. And it would allow folks to buy health insurance on the private market using Medicaid dollars. So the state would still get the match, but folks would be in private insurance. Those who are medically fragile would be put into the regular Medicaid program. And there's concern among some of our legislators that it's going to be too costly. The federal government has guaranteed that they will continue to pay 90% of the cost. So there's kind of a scale. Right now, they're paying 100%, and it will go down to 90. So the state is never going to be paying more than 10%. And by doing that, the state will be getting billions of dollars in revenue, and well over 100,000 people will get health care coverage. So there's kind of this generator effect with Medicaid dollars, where it creates jobs for people. It creates health care for people. People have healthier lives. They're more productive. They become more productive taxpayers. I'm obviously biased, and I think our state has been really remiss in not doing some sort of Medicaid expansion. But you may want to be contacting your legislators about Medicaid expansion.
We do
I
need
mean,
that.
Ed Red he's there. He understands it, he sees people in the clinic, he knows the need and the difference it would make. Senator Knudsen, not so much. So that may be somebody who you want to contact. You may want to contact Senator Hilliard.
We need to come.
So that's a biggie. One of the things that we're going to be working on for services for people with disabilities is increasing the hourly rate that direct care staff are paid to work with people with disabilities. There is currently a workforce crisis. The turnover rate is horrendous, and part of the reason for that turnover is that the economy has improved. Working with people with disabilities can often be a very difficult job. It can be strenuous, it can be, but sometimes you're at physical risk and you're not getting paid even as much as somebody who is working in a less hazardous job, flipping hamburgers. So we're hoping that there'll be something towards a rate increase for direct care staff. So those are two biggies.
Sherry's good.
Yeah.
Do you have any idea if they're gonna consider improving the waiver situation?
You mean the waiting list?
Yeah.
Okay, so we've really got this dilemma this year, because every year we advocate for more dollars to take folks off the waiting list. Well, now, when you can't find staff to serve these people, it's taking twice as much time, even for those who were taken off the list or authorized to be taken off the list this, in July. It's taking over 100 and some days for them to be brought into services this year, where before, we just saw a chart yesterday, it used to be like about 42 days, so a little over a month for them to be brought into services. And now it's over 100 days.
Yeah, the 114, yeah.